Wellness 101, thriving, not just surviving. Medical school is challenging, but staying well physically, mentally, and emotionally is essential to your success. In this episode, we'll talk about the simple but effective ways to maintain balance, recognize signs of burnout, and access the support you need. Remember, taking care of yourself isn't a luxury, it's a necessity. Let's dive in.
Hi, I'm Dr. Jessie Gold. I'm the Chief Wellness Officer for the University of Tennessee System and an Associate Professor in the Department of Psychiatry here at the UT Health Science Center. I work in University Health Services where I see faculty, staff, and students as patients, and I have in my own job experienced burnout and depression because we're human and we all do. I'm excited to dive into this episode called Finding Balance, Wellness and Resilience in Medical School, using my knowledge from a system, clinical, and human level. Let's get something out of the way. It's kind of the elephant in the room. Medical school is hard. It's a lot of information to learn in a short amount of time. It's full of tests, long hours, and really challenging patient stories. Plus, we are often overachieving perfectionist types, so that alone can take a toll on how we view the challenges of training. But it is possible to take care of yourself and take care of others. In fact, it's necessary. There's a lot of research that says if we are burned out, we are at risk for depression and suicide, and our rates for both are higher than age-matched peers. And if we are burned out, we might think, at least I still show up and I'm taking care of patients because they need me. At least I'm here supporting my colleagues. But patients are more likely to have lower satisfaction, more errors, and longer time in hospital when they have burned out clinicians. Even our colleagues are at risk of burnout if we're burnt out. Evidence shows that the environment is contagious. So you need to learn ways to take care of you, but also for your future patients and colleagues. If you learn them now and figure out what works for you, it'll be easier to turn to them in residency or later in your career when you will still need them. This is a great opportunity to learn about you and not just microbiology or clinical skills. Let's talk a little bit about stress management. There's a difference between stress and anxiety. Stress is a response to an external cause, like an exam, and often goes away when the situation does. It can be positive or negative, like inspire you to actually study, but then you lose sleep because of it. Anxiety, on the other hand, is often internal and a reaction to stress. It can persist even if there is no threat, like the exam is done, and you've long finished all of the stuff that you need to be studying for. Think of it this way. Evolutionarily, we're designed to run from and predict threats. If there was a dinosaur or the environment looked like it was ripe for one, we try to prevent ourselves from being eaten. Our heart rate increases, our muscles tighten, our breathing increases as we get ready to run. Again, that helps in the short-term situation, but sometimes our detector gets a bit out of whack and we predict threats when there aren't any, or we think the threats are bigger than the actual thing that's causing them. And that's where we need to learn ways to mitigate that response. What you do is often called a coping skill. Those skills are really personal, and I could tell you a million different ones to do, but the one that you'll actually do is the one that you like. So it's really important to figure that out now so that you don't have to figure it out when you're really anxious or when you're really stressed. You do have time for them though, as most of my patients and people that I talk to in healthcare will say, I don't have time to take care of myself. A lot of the things that people do are really quick. They're not 45-minute exercise classes, though if you have time for those are good too. Some good options can include calming techniques like grounding or deep breathing. Sometimes in the moment when you're really activated, it can be really easy to just kind of get in your head and not be able to focus. So the way to do that is to get more into your body. That could be noticing where you are in space. That could be doing something called the 5-4-3-2-1 method, where you look at 5 things you can see, 4 things you can touch, 3 things you can hear, and sort of down the senses that way. All that does is bring you out of your head and into you. Sometimes you can do something called progressive muscle relaxation, and that can help too, which is just really going through all your muscles and flexing them, including your face and your feet, until you're basically calm as a result. Deep breathing is just exhaling longer than you inhale. It makes us physiologically calm down, and most people can't even recognize that you're doing it. So if you're afraid that you're anxious or stressed and someone will say something, it's a really easy way to just calm without people noticing. Another thing that I've also found is really helpful for folks is the serenity prayer. God or not, the sort of essence of it is really, really helpful, which is there are things you can control and things you can't control, and knowing the difference is really important. So if you're really stressed out about a lot of things, write them all down on a piece of paper and go, can I control that or can't I? There's a lot of stuff in healthcare that we can't control, and really stressing about that will just make us feel worse and make us more frustrated. So circle those things you can control and you'll feel more effective when you actually can get some stuff done. Another thing some people like is mindfulness or meditation. There are lots of apps that you can download that can help with that, like Calm or Headspace, and they're free versions, so you don't always have to pay for them. But there's a lot of evidence that mindfulness and meditation can help with stress and anxiety. I will note though that it's a bit like a muscle that you have to flex, so the very first time you do it, you might absolutely hate it, so you should try it a couple times before you say that's not for you. Another thing to keep in mind is don't just study and study and study and study and never take a break. I have patients who will say to me things like, I can't go to sleep because I won't get that extra hour of studying. Sleep is really important in those circumstances, and so are breaks. What a break looks like is actually getting up from your computer and doing something else. People had water cooler conversations for that because you would get up and you'd talk to someone and you wouldn't be talking about school. That can be a really helpful use of it, a little brief social time. But no matter what, change tasks. Don't just sit at your computer. And don't just think that you can then scroll on social media. I think we think scrolling is really mindless and it doesn't affect our mood, but the stuff we're seeing when we're scrolling does affect our mood. So it's really important that you notice that that's not a way to be checked out, that's probably actually going to make you feel worse. Some people also like journaling. So if you're not a person who wants to get into your head and do mindfulness, or you're not a person who's more physical and wants to go for an exercise, just spending 15 to 20 minutes writing down how you're feeling, getting it all out, not editing it, not even using a computer, using pen and paper can be really helpful. Sometimes people use this as a way to focus more on the good things in their day or having gratitude, and that can be really helpful, again, when things feel out of control, but also because we're perfectionists and all we remember is the really hard thing that happened to us. So our brains are really designed to say, you ate a poison berry, you should remember you ate a poison berry, not that before you ate the poison berry you were hanging out with your friends and having a really good time. So I'm not trying to say be toxically positive and only remember the really good things of your day, but I'm kind of saying we have to challenge ourselves to do both. So you might be, I made a mistake on this exam, I had a challenging conversation with the professor. But before that, you might have had a good time with your friends. Somebody might have thanked you for something you did. So having that balance makes a lot of difference. Speaking of balance, another thing that we really do need to focus on in healthcare is how we treat ourselves. We can control that. You can't control how other people react. You can't control how patients react. You can't really even control the system that we work in, but we can control how nice we are to ourselves, and for the most part, we're not. So if you ever heard the things that you said to yourself out loud, you would never say them to a friend. So imagine that you made a mistake. The first thing we do is we say, we're stupid, we don't deserve to be here. Who even let me be a doctor? How did I get here? Someone should probably tell me I can't be here anymore, right? We go right down that rabbit hole. If a friend came and said, I didn't do really well on a test, your first reaction wouldn't be, that's because you're an idiot and you don't deserve to be here, right? Like, that would never make you friends with that person. They would never be friends with you. Hear the things you say to yourself and recognize that for the most part, we wouldn't be friends with ourselves. So we need to reframe those things in our head even once a day to try to think, well, how would I frame that to a friend, and be a little nicer. Besides the things that we kind of think about as coping skills, there are the things that we always talk about: sleep, exercise, and nutrition. I'm sure even as doctors in training, you hate when doctors say you should sleep, exercise, and eat well, but they're not wrong. There's a lot of evidence to say they're really important in your success and overall well-being. If you're having trouble with some of that, a schedule can really be helpful, because some of anxiety comes from unknown. So if you have a schedule, you can say, well, I'm gonna go exercise at this time. Well, I'm gonna take care of myself at this time. I go to bed at this time. And that can give you some control over things. Sleep is also very scheduled. We slept really well when we were younger because we would get in our PJs, brush our teeth, read a book, and then go to bed. That's called sleep hygiene. For the most part now, we look at our phones right before before we go to bed, or we're studying in bed, and that's really poor sleep hygiene. So whatever you can do to make a routine can convince your brain, hey, it's time to go to bed now, just like it did as kids, and that can be a lot easier. So as stressful as school can be, as frustrated as it can be to be told to eat well and exercise and sleep, I'm gonna tell you to do that because it can make a really big difference. Another important topic that comes up a lot in healthcare is burnout. Burnout isn't just work is hard, school is hard, and I feel stressed because of it. It's a lot more than that. So when we think about burnout from a scientific perspective, we're talking about a workplace associated condition, not a psychiatric one, but that's made of a constellation of three things. The first one is emotional exhaustion. So at the end of the day, you just feel really spent, like you have nothing left. You gave it all during the day, and when you want to do other things, you have nothing left and you're just sort of checked out. The second one depends on who you ask, but can either be depersonalization or cynicism. Cynicism is like anger, being angry a lot. We don't always notice anger. We're really good at noticing things like sadness and noticing things like anxiety, but anger is a warning sign too. Depersonalization, on the other hand, is basically that thing that we try to teach you in healthcare so that you don't feel all of those really hard stories that your patients tell you, but all the time. It's like you're not as empathetic. You're going through the motions. You see patients as objects. You might not notice it, but maybe a patient would or a friend would, and that's really important. And the third one is a reduced sense of personal accomplishment. You're doing less, you feel like you're doing less, someone said you're doing less. That's the one that people usually show up in my office for, because we're really trained actually like since college to notice only when things affect work. So we're able to say, hey, I'm doing less, so therefore something's wrong with me. The other ones we tend to sort of blow off as like side effects or consequences of hard work, and they're not, and that's important. In medicine, there's about 50% of us who are burnt out, and that was pre-COVID, and those numbers are bigger now. So it's really important to notice it and not just go, well, my classmate also looks burnt out, so I must be just dealing with medicine and medical school like everybody else. Just because it's normalized doesn't mean it's okay, but it does make it a lot harder to say, I'm struggling with something and I need help for it, and not blame yourself for it. I'm here to say that you shouldn't blame yourself for it. If you want help for it, you should get it, and you shouldn't feel ashamed about it. Burnout also is a risk factor for a lot of things, including depression and suicidal thoughts, and it's really important that we don't just say burnout is this thing that we feel and we get over it and it's part of being in medicine, because it has those big risks and it can really affect us as humans. So it's really important that you ask for help and ask for help early, and there's a big strength in that. Medicine tends to tell us being vulnerable is a weakness, and it shouldn't. Being vulnerable is a strength. Empathetic and courageous leaders are vulnerable. Creativity comes from vulnerability, so you should feel able to do that. Importantly, when we're kind of thinking about this, is we don't do a really good job checking on ourselves. We spend a lot of time checking on other people, but we don't actually go, okay, well, how am I? How do I feel? If you do that, you'll notice subtle changes in your sleep, in your mood. No one else is gonna notice those for you. You have to do it for yourself, and it's a hard thing to get in the habit of doing, but even if you do it at the end of the day or a couple times a week, you'll be able to notice quick changes in yourself and maybe make a small adjustment. The reason that matters is, for the most part, we're only noticing when we're in what I call the red zone. So where you're at a point where it's interfering with your work, where you need to go to my office, where you need time off from school. A lot of us could have noticed symptoms earlier, like in the yellow or the orange, which are times where we're starting to see symptoms. Maybe they don't interfere with school yet, and we're sort of like, hey, I'm fine, I'll just keep going, and it doesn't interfere with work, and it doesn't matter. But it does, because if you noticed it then, maybe you wouldn't have to get to the red zone. We don't all have to. There are things like biological reasons and your own personal history reasons why you still might, but not everyone does, and it's really important that you start checking on yourself early and often, and that becomes part of your routine. When I think about that too, coping skills can feel a lot different depending on when you're taught, right? So if you're at the red zone, you're 10 out of 10 burnt out, and I tell you should go do yoga, you'll basically tell me that that was the dumbest idea you've ever heard and maybe want to punch me in the face. Because I understand why you would. You're really, really burnt out. You don't think that's a good idea. If you're in the yellow zone, let's say you're 3 out of 4 on a scale of burnout, and I say go do yoga, you'll go, hey, that sounds like a really good idea. I've never done that before. That sounds fun, right? So it's not that the coping skills are always wrong, it's that we tend to not use them until pretty late, so checking in is really, really important. Part of checking in is also checking in on other people. So besides things like meaning and purpose, which are really important to making sure we're grounded in what we're doing and that we don't burn out, what brought you to this field, what are you interested in, how do you ground yourself in that? The other really important thing to be preventative against burnout is having a support system, having someone you can check in on. It isn't that you need a million friends. You just need a person that you can tell the truth to and that you can say, this is hard. This isn't something I've ever done before. I didn't do well on that test. Whatever you have to say where you actually are telling someone the truth, that's basically what gets us through all of this training. You go through with a cohort for a reason, and honestly, as a faculty member, sometimes I get envious of that because you have a built-in support system who's going through the exact same things as you, so you should learn to rely on them and be able to tell them the truth about what you're experiencing, even if it's just that one person. If you're unable to feel like that's what's helpful, or you feel like it could be helpful to have someone who's not in school with you, who isn't your friend, therapy is really, really important too. A therapist is basically an external person who's there to support you through the stressors that you're having. There's no wrong time to go to therapy. Someone's not going to say, how did you get here? You shouldn't be here yet. So if you feel like speaking to someone else could be helpful, it's really important that you feel empowered to ask for that help. I started seeing a therapist in college, and I still go to therapy every week, and I think it's really important to me for being a good doctor. I think sometimes we think about therapy like, I have a problem, I need to go to therapy to fix that problem, and then I'm done. I've always thought about it like, going to therapy makes me understand myself better, which helps me be better at understanding why patients affect me certain ways, why my work affects me certain ways, and if I could understand that better, I would overall be a better doctor, which matters too. Hopefully all of this stuff is helpful as you go about your day and you're trying to figure out how do you adjust to medical school, how do you adjust to the different years of medical school. Transitions are always hard, so be kind to yourself and know that it's okay to ask for help.